got that recording button. People will start flowing in. I'll give it like 10 or 15 seconds and then I will start. But all right, I see people flowing in. Good afternoon or good evening, everybody, depending on where you're joining us today. My name is Adam Ortega. I'm the communications coordinator for Alaska Community Action on Toxics. And today is Che Alaska Talk is about PFAS in the metabolism and how specifically it affects younger populations in adolescents. Before we get started, I do want to say that Che Alaska is a program of Alaska Community Action on Toxics, but it's also part of Che's larger international partnership, Collaborative for Health and the Environment, of over 5,000 individuals across the globe providing environmental health news. And some of the research and health professionals behind that work do amazing stuff. So we'll make sure everybody has the relevant links following this call, also with links to some other great webinars from our partners down in the lower 48 and across the world. And we'll make sure that you have this recording sent to your inbox. I do want to introduce our very special guest today, Dr. Jesse Goodrich, assistant professor at the University of Southern California School of Population and Public Health Sciences, one of the co-authors of this paper. So without further ado, I will pass it over to Dr. Goodrich. And thank you so much for being here, Jesse.
Yeah, thank you. Can you see my screen?
Yes.
Great. Yeah, so thanks for inviting me. I'm really excited to talk today about this concerning issue. And I think the work you guys do is great. So like Adam said, I'm an assistant professor at the University of Southern California, Division of Environmental Health. And I'm an environmental epidemiologist. So I study how PFAS impact health of children and adults. But I'll talk today about children. So just as a general starting point, I think that it's important to say that the health of Americans has really been declining since the 1990s. And the question is really why. So on the right-hand side here, you can see a map of obesity rates in the US in the 1990s, in 2010, and in 2030. This is the predicted prevalence of obesity. And as you can see, there's clearly geographical differences in these, and that really suggests that there's environmental factors that are playing a large role in obesity. And this is important because obesity is really driving rates of a lot of other cardiovascular diseases, cancers, stroke, that sort of thing. So like I said, the question is why? And it's clear today more than ever that the environment really plays a key role in the development of many of these diseases. And it's also clear that differences in environmental exposures can also explain some of the large disparities in the epidemiology of these disorders. So to kind of jump into the background of obesity, obesity is really a complex problem. It's the basis of many major chronic diseases. And more importantly, like I said, differences in environmental factors can actually drive some of these. And this hypothesis of how metabolism disrupting chemicals may actually play into this started in the early 2000s. So there's this hypothesis called the obesogen hypothesis that proposes that environmental chemicals that promote obesity actually act to increase fat accumulation. They alter metabolic set points and they alter hormone regulation. And so what this shows is chemical production that really started a lot after World War II, and then increasing rates of prevalence or increasing prevalence of overweight and obesity, which started in 20 to 30 years later. And so my research really looks or tries to look at why this is happening. So in particular, sorry, my slides are, there we go. So in particular, I'm interested in per and polyfluoroalkyl substances. You've maybe heard these called PFAS or forever chemicals. And this is really a ubiquitous source of toxins. And to kind of illustrate this, so there's over 12,000 known PFAS chemicals. And these chemicals have been used in industrial appliances, industrial applications like firefighting foams, and lots of different consumer products. They're kind of concerning because they're resistant to degradation. And so they stay in the environment for a long time, even if they go into, water sources and those go out to the ocean, they stay there. They don't really break down. And because they stick around for so long, they're resistant to degradation. They're detected in the blood of almost everyone in the entire world. They increase risk for a lot of different diseases. And so here I just highlight one, that they increase risk of non-alcoholic fatty liver disease, which is an important risk factor for cancer, but they also increase risk for a bunch of different diseases. This is just a graph from the Environmental Working Group, which is a great resource that tracks some of the PFAS contamination across the US. And this shows that as of yesterday, I think, there's over 2,200 different water contamination sites in the US. And these drinking water sources supply water for up to 110 million Americans. Alaska's also impacted. And so actually in preparation for this talk, I kind of looked into Alaska a little bit more, and in particular Anchorage. And there's these 3 Air Force bases or military sites that have really high contamination levels around Anchorage. So even though there's not as many dots in the area, these are kind of concerning levels that show that PFAS is an issue. You can do this pretty much anywhere you live. You can go on here and you can find these contamination sites and see that these levels are, there's PFAS levels pretty much everywhere. So we want to then, my research really then starts to, is focused on trying to figure out what these compounds do. And so over the last 10 years, there's been really an emergence of different research on how PFAS impact health, and especially how PFAS impact the health of children. So to kind of start, what we've done, what our research group has done, is that we've looked at how PFAS impact different specific diseases. So this just shows 6 different papers that we've put out over the past couple of years. And we've shown, like I mentioned earlier, that PFAS impact liver health, PFAS impact glucose homeostasis, which is a risk factor for type 2 diabetes. And kind of among other things, they also impact risk for cancer. But I want to focus on one area in particular today that really laid the basis for the study that I'm here to talk about. So for this study came out in 2021. So we performed the first study to look at whether PFAS exposure in overweight children was linked to risk for type 2 diabetes. And to do this, we took a group of children from the Los Angeles area. We measured PFAS levels in them, and we tracked how their glucose metabolism, how they're how they're processing sugars. We measured those for up to 10 years in these kids. And what you'll see in this figure is a picture of how the glucose metabolism changed over time. So this variable HbA1c, this is a measure of kind of long-term how kids are processing blood sugar, blood sugar. And higher levels mean that they have higher risk for type 2 diabetes. You can see what I've done here is we plotted it in early puberty, pre-puberty, early puberty, mid-puberty, and then all the way through post-puberty. And you see that when these kids were exposed in early puberty, pre-puberty or early puberty, those with higher levels of PFAS actually developed by the end of puberty higher long-term levels of blood glucose, blood sugar. And this really kind of predisposes these kids to being more at risk for type 2 diabetes later in life. So I guess I should also say that these findings were primarily in girls. So this figure just shows the results in girls. And so it's kind of interesting. There are these sex impacts as well. So we think that maybe girls are more impacted, potentially because these chemicals are actually impacting hormone regulation. But this previous work is really limited because until recently, scientists have been really limited in the ability to examine how exposure to environmental toxins like PFAS actually impact health. This is because in order to figure out whether or not PFAS increase the risk of a specific disease, like type 2 diabetes, you have to actually go out and convince a bunch of kids and their parents to take part in a study. You recruit them. They have to come back year after year to see who gets diabetes. And because of this, running studies is really expensive. And we really only study the diseases that we have prior evidence of. So we only, because of this, have evidence that PFAS impact a limited number of diseases. And this kind of highlights it. We only study the PFAS that we know about and the diseases that we have evidence for. But like I said, there's over 10,000 different PFAS that exist. And so this is really a limit of the previous research. And it's something that we're trying to address using some really cool new technology. So there's a lot of cool technology that's come out over the past couple of years. And I'm not going to get into too many of the details on this because it's a little bit complex, but luckily technology is helping us to overcome the limitation of this, the fact that we can only measure kind of one disease at a time. So in general, probably everyone knows that it's now pretty easy to measure DNA in a small sample of blood. But most people probably aren't aware that similar advances have been made in many other areas of biotechnology. And one particularly useful technique that we're now using is a technique called metabolomics. So this allows us to measure thousands of different chemicals in just a tiny blood sample. These chemicals are known as metabolites, and they're basically they're chemicals that are produced in your body and they can give an in-depth picture of how your internal biology is working, how your internal metabolism and all these different metabolic pathways are actually working. This figure is just kind of a cool figure that shows the complex relationships that have, that we know about between these different molecules. So, this is this circle is a biological process that we know about, and these lines here are different biological processes that we know about. And so by measuring, these thousands of metabolites, we can really get a better idea of how PFAS impact biology as a whole. So we're not limited to just looking at one disease at a time. Now we can really see more of the impact on a more holistic level. And I should say, these biological pathways are really fundamental to making everything in the body work. And it's because of that fundamental nature that understanding these biological pathways, or even interrupting some of these biological pathways, can make really big changes in the risk for different diseases. So the study that I want to talk about today, or I want to spend a little bit more time talking about, is a study that just came out recently. So this came out, a couple months ago, and we used this technology to study the effects of childhood PFAS on the biological pathways that tell us more about the general diseases that that PFAS may be causing. And sorry, I'm having trouble with there we go. So the goal of this study was to, like I said, measure PFAS in people's blood and measure these chemicals in people's blood. And we did this in two different groups of kids. So we did this in children or adolescents. We did these in young adults. And we then did this kind of comprehensive analysis, this really cool statistical analysis that let us look at how PFAS mixtures, so like a combination of all these different PFAS in people's blood, impacted the totality of these biological processes. We did this in two different groups to see if, to make sure that our findings were actually robust, that what we were seeing wasn't just by random chance. And this is the most complicated slide that I'll show today, but basically we found that PFAS exposure really alters critical biological processes that are linked to a lot of different diseases. So this figure shows, this is the results in the children. Basically, the further to the right something is, the more impact that PFAS has on it. And you'll see these different groups. So these are amino acids. These are basically the building blocks of proteins. These are lipids, and these are some other ones. But basically, these amino acids and these fats, these lipids, are really critical to, like I said, a bunch of different diseases. So, for example, this is just a couple of the main ones, but it is by no means comprehensive. Tyrosine metabolism is linked to thyroid disease. It's linked to kidney disease. It's linked to overall kind of metabolism of the body. So tyrosine metabolism actually helps to determine the metabolic rate of someone's body. So whether or not you kind of burn energy faster or slower. And that was one of the really big findings from this study. The other ones are these lipid metabolism pathways. So there's this fatty acid biosynthesis, which basically means that kids that had higher levels of all these PFAS had the liver that was making more fats. And so they had higher fat levels in their blood. And that's really concerning because, again, this just means that later in life, they're at higher risk for several different diseases, including fatty liver disease and different cancers down the road. And we saw really similar associations in young adults. So especially important was this finding with the tyrosine metabolism, this pathway that's related to thyroid function and overall kind of body metabolism levels. One of the interesting things, though, that you see from this figure is that the impact of these PFAS was a lot higher in children than it was in young adults. So even though we saw the same pathways, we saw the same biological processes, the effects are a lot bigger in the children. And so this really suggests that children have really high susceptibility to some of these chemicals. And this is something that I think is really important to keep in mind when we're talking about public health interventions, is that it's important to kind of make sure that kids are protected. And so kind of just to summarize all of this, this was the first study that actually took this approach where we looked at all of these different metabolites in kids' blood. We measured a bunch of different PFAS, and we looked at whether or not PFAS were causing these broad biological changes. We saw pretty consistent results across the two different groups, which means that we were pretty, these are more likely to be actually like real results. So it adds evidence, it adds scientific evidence that these are real results. And I think importantly, especially for the public health impact of this, we saw that this was really driven by PFAS mixtures. So there wasn't a single compound that was really driving these results. There's a couple PFAS that people really know about. These are called PFOA, PFOA, or PFOS. And these are the ones that most scientists have studied for the past 10 or 20 years. And there's a lot of evidence out there now that these have harmful effects. But this was the first study that really looked at a lot more of these. And like I said, looked at how those, how the group of them impacted PFAS or impacted biological pathways. I should also say that the reason this is important is because since there's now a lot of evidence that these older PFAS, so PFOA and PFOS, are harmful, companies are starting to ban these, or they're phasing them out. They're banned in a lot of areas, and so they need to have replacements for them. And so they're making chemicals that are very similar. They're still PFAS. They just have like one carbon chain that's different. And these chemicals are actually having many of the same effects. So that's something that we're trying to kind of get out, let people know about. And I kind of already talked about this, but these diseases, thyroid dysfunction, oxidative stress, inflammation, and lipid metabolism, these are all just fundamental processes that increase the risk of pretty much every chronic disease. So We're talking like heart disease, we're talking type 2 diabetes, we're talking stroke. And this is important because these processes, actually, they take years to cause the disease. So we need to kind of start when people are children, when in children, we need to prevent these processes from taking root, turning into these diseases later in life. And like I said, these findings really support that PFAS should be regulated as a class. So instead of taking this one-by-one approach to studying PFAS, we really need to be looking at these together, saying, all PFAS should be banned, or all of a certain type of PFAS should be banned. And if you're interested, there's some more information about this. This is the paper that came out. This was in Environmental Health Perspectives in February. So with that, I like to kind of end this with something that's maybe a little bit more positive. So PFAS are bad. They cause a lot of different health effects, especially in children. And the first thing is we really need some more research to figure out not just what PFAS are doing, but also how we can take or how we can make some of the effects less, how we can protect people's health even if they've been exposed. This is important because PFAS stay in the body for a long time. So once someone's exposed, that means they're going to be in there for years. A lot of the PFAS stay in your body for 5 to 7 years. And so in those cases, you can't undo what's already been done. You need to figure out ways to prevent some of the adverse health effects. But also, with that in mind, it's really important to try to reduce PFAS exposure in the first place. And so two things that are kind of things that we can start to do. So as we do more research about PFAS, there's going to be a lot more information that comes out about what you can do to reduce your exposure. And I see Adam put a link in the chat that has some information about PFAS levels in Alaska, but also I'll show you a couple of resources, and this information is starting to kind of become more easily available as we do more research. We also are starting to think about the fact that since you can't reduce levels once you've been exposed, what do you do instead, And the answer that we're really coming to is that it's important to maintain a healthy lifestyle to offset the adverse effects. So, unfortunately, that's not always easy, but things like diet or exercise could potentially interact with PFAS levels to cause more harm than if you just had PFAS exposure by itself. We're also starting some new interesting research on other types of interventions that might be able to prevent some of the damage, but those are a couple of years out. So hopefully I have some more to report in a couple of years. So then there are a couple other resources. And the one that I really like a lot is the Agency for Toxic Substances and Disease Registry. So this is part of the CDC, and they have a whole website about PFAS and your health. I didn't realize this until I went to take a screenshot of this recently, but they have this interesting tool now on blood PFAS level estimation. Haven't played around with it too much, but it's an interesting idea that I recommend, just to figure out kind of the factors that it's taking into account. I recommend people playing around with that because it's kind of cool. And they've got a bunch of other cool resources on there as well. And then, like I said, a lot more information is coming out about these recently. So Washington Post yesterday had an article about how to avoid eating foods with forever chemicals. I'll refer to the article refer people to the article to get all of the details. But, some of the things that they mention is that it's important to figure out if your water is contaminated. And a lot of public utilities now are kind of either required to or voluntarily testing whether or not they have PFAS levels. If your water does have PFAS, then it's important to either switch to drinking bottled water or to put in a water filter that has that can actually filter out PFAS. A lot of foods are associated with PFAS exposure. And so one of the big ones is seafood or fish. Fish is a really interesting example because on one hand, we know fish is healthy. So eating fish is something that's good for you. But at the same time, it does have higher levels of PFAS. In the past, we've also talked about this with mercury, which is still a concern, but there's really a trade-off where you don't want to be having fish every single meal. You want to have it sometimes, so don't completely stop eating it. But that's something to be aware of. Also, if you're doing your own fishing, oftentimes there'll be state advisories, or in some places there'll be state advisories if there's been PFAS contamination in a specific area that you should be aware of. And then the other things that people can do, the other big one is not cooking with nonstick pans. A lot of nonstick pans, Teflon is the big example, are made with PFAS. So that's just a couple ideas. And yeah, I recommend people reading that article because it's kind of interesting. So with that, I kind of left some time for questions and discussion, but this is really a team effort. And so I need to thank a couple people, Lita Chassie and David Conti at USC have been really an integral part of this. And we have collaborators kind of across the country. And a lot of our funding comes from the National Institutes of Environmental Health Sciences. So I'm happy to take any questions, and yeah, thank you.
Thank you, Dr. Goodrich. Wonderful presentation. And yeah, I think you really kind of speak to the importance of not playing whack-a-mole with, individual PFAS, right? There's over 12,000 of them. So we need to regulate it as a class. And that's something that ACAT is really pushing for too. We do have a question here from an anonymous attendee. They say, for the type 2 diabetes study, how many children were in each group, and how were high-low PFAS exposure groups determined, and what confounding effects were controlled for between groups? That's a lot.
All right, so I'll go back to that slide if I can find it. Here we go. So in this study, so how many children were in each group? Yeah, so this was a group of over 300 kids. And the group with high PFAS, we just kind of split them up by, those were kids who were in kind of the top half of exposure, or sorry, top third of exposure. So there were about 100 kids with high PFAS and then 200 kids with low PFAS. And the thing that I don't show on this slide is that we also actually followed up in that second cohort that I mentioned in the next study. We did the same analysis and found similar results. So we're pretty sure that that addresses some of the concerns about confounding that you're mentioning. But we also spent a lot of time trying to think about, what was confounding this relationship. These are factors that, basically making sure that there's not something that we're not thinking about that could be explaining this relationship. So we controlled for a lot of things like socioeconomic status, so puberty, which you see on here, is a really big one. And that was kind of driving our analysis. And then we controlled for a couple other, like ethnicity, that sort of thing.
And Elizabeth asks, hi, you mentioned the testing was done on Hispanic children in Los Angeles. Do you find that certain groups of children are more impacted? And if so, why?
Yeah, that's a good question. So the reason that we were interested on this specific population is that Hispanic children, but also other kind of ethnic minority, or so American, like Native American populations also. A lot of these groups are at really high risk for metabolic diseases. So we see really high rates of type 2 diabetes, cardiovascular disease, a lot of these different diseases in these populations. And so one of our hypotheses was that part of what could be driving this is differences in environmental factors, including environmental exposures. So this is really an environmental justice question. And I don't have the data on different groups of children because we've mostly looked at this population, but our hypothesis is any group that's at risk for obesity or metabolic diseases is likely to be more impacted than a group that has kind of healthier lifestyles, healthy diet, exercising a lot, that sort of thing.
Yeah, and it looks like our director wants to speak on this. I hope that I haven't made a fool of myself, Pam. I'm going to allow her to talk, but I do want to echo Dr. Goodrich how this is an environmental justice and environmental racism issue. Specifically in Alaska, we have PCBs and POPs, persistent organic pollutants, that travel on ocean and wind currents and bioaccumulate in subsistence foods. So that's we do a lot of research through NIEHS as well to biomonitor and see what's in their blood. So I'm going to hand it over to Pam Miller, Executive Director at ACAT, to talk a little bit more on this issue.
Hi, Adam. I accidentally raised my hand there, but I did want to point out that we have done quite a lot of work on PFAS and have several peer-reviewed publications, and thank you for posting that in the chat. And to mention that our work on Sivokak has shown a link between PFAS exposure and thyroid disruption. So that kind of correlates with some of the findings that you are talking about, Dr. Goodrich. Thank you.
Yeah, thank you, Pam. And yeah, I mean, I also interviewed a Dr. Aker, who was working out of Quebec in the Canadian Arctic and was showing some of the same results: persistent organic pollutants, levels of PFAS higher in seal fat, caribou, fish, and yeah, exactly, fish. And I also think based on your hypothesis as far as like, yeah, demographic and where you are geographically. I mean, if you're in a food desert, you probably are eating more fast food that has PFAS packaging, right? We know about PFAS is what makes them really good, also makes them really bad. We do have a couple more questions here. Elizabeth also asked, is there any testing going on among middle-aged folks to see their early exposures in current health conditions?
Yeah, so that's a good question. As you can imagine, those studies take a long time. And I'm working now with a lot of different groups where we are trying to leverage studies that were going on in the early 2000s or even late 90s to do exactly that. And so in one of my other areas of interest, we've measured PFAS in a group that was in so it was half in Hawaii, half in LA. PFAS levels were measured in the late 90s or early 2000s, and then we followed them up through 2020 to see if it was associated with liver cancer. And we found kind of alarmingly that it was. So what we think is the longer follow-up you have, the more severe, the longer you track people, the more things we're going to see. So this is an area where we're really trying to do a lot more research.
Yeah, and I will also echo that sentiment, Dr. Goodrich, is as far as like how accessible some of the PFAS research has become, even over like the last 6 months. Anywhere from NPR to AP News has picked it up, and it's like these are forever chemicals. Above 95% of humans have this in their blood, which I know raises red flags and people get scared, but we are just trying to inform you on how to reduce your exposure. We do have a couple more questions. Patty asked, what would you suggest to lower the effects on children that already have PFAS in their system?
Yeah. So I think the first thing is to recognize that it's important to try to cut off exposure as quickly as possible. That's not directly answering your question, but that's the most important thing. And then after that, it's trying to address some of the lifestyle factors that may also kind of increase risk for different diseases. For diabetes and obesity, that means that you're going to want to try to have healthy diets. You're going to want to try to get kids to exercise. Something I didn't talk about here, but another study that we have coming out right now is about how PFAS actually impact bone health, so bone metabolism and bone development in kids. That increases risk of osteoporosis later in life. And so in that case too, having lifestyle interventions is really, I think, the best way that we have right now to address some of these concerns.
All right, one more question from Anonymous. When the data for the metabolic effects were shown, you discussed the significance of the dots on the right side of the dotted line as being more affected by PFAS. There were some metabolic effects that were shown to be the left of the dotted line. What do those mean?
Yeah. So these dotted lines, this is kind of just a scientific thing, but this is our threshold for statistical significance. And so the dots that are on the right-hand side, we call statistically significant. And that just means that there's pretty solid evidence that these things aren't just happening by chance. That's always something that you have to worry about when you're when you're doing epidemiological research. So yeah, that's what these are. Yeah.
We do have a couple more questions. Marcia, this one's a little bit longer, so bear with me. I've recently been rereading Colburn, Myers, and Dumansky, Our Stolen Future, 1996, which first exposed the problems associated with endocrine disrupting chemicals. It is great to note new research that supports the conclusions and suggestions they made there. I'm writing a biography of Theo Colburn and aim to focus on PFAS in the final chapter, so all this work is very helpful. As opposed to individuals having to follow healthy living protocols, how can the general public pressure regulatory agencies to ban the class of PFAS so we can cut off the point sources that are causing these maladies? Maladies? I probably said that wrong, but thank you for that context, Marcia. That's great.
Yeah. Well, yeah. So that's a great point. You know, we need to figure out how to ban these. There's been a lot of pressure on this front recently. That is actually something that's really given me hope for this problem, is that every time we publish one of these studies, it is getting noticed. And I think that that's really, really great, because it puts, you know, it keeps the public informed, and it keeps lawmakers informed, it keeps regulatory agencies informed. I think we are starting to see some action on this. One of the things that's hard, though, is that these are already in water sources. They're already in our food sources. And so even banning these is not going to get rid of that issue. So the other thing that we're doing is trying to figure out new technology to actually remove PFAS from drinking water sources, or drinking water sources is the big one. That's a really hot topic right now. But I think your point about regulatory agencies is really critical.
Yeah, and I definitely agree. Putting pressure on legislators to pass PFAS policy. Just what's going on up here in the Arctic. We recently were finally able to get some legislation passed that would phase out PFAS from firefighting foams in Alaska, which is our primary source, which is huge. And we went to Juneau, talked with legislators, policymakers, and said, hey, this is a nasty class of chemicals. We need to stop this. And there has been lots of over 100 PFAS related policies across the lower 48 to tackle some of these issues. Turning it off at the source, if you will, stopping it at the source. But yeah, water is the big thing. And we should note too that the water filters that would remove PFAS are very experimental and inexpensive. Reverse osmosis, I know, can filter out some, but you know, it needs more time before that's going to be anywhere accessible to anybody in the nation. We actually have 4 questions left. I think I'm going to take these 4 and then we're going to call it a day. Elizabeth asks, how can parents or individuals find out their own or their child's PFAS levels? And is there a test they can ask their doctor about?
You know, there is some action towards trying to get physicians aware of different approaches for this. Right now, it's not widely available, but there are starting to be some companies that that do offer these tests. I don't know how easily accessible they are, but that's something that we're kind of trying to get people, get physicians aware of. Sorry, I don't have a better answer for that. I'm hoping that in the next couple of years, that'll become a lot more accessible to people.
I mean, yeah, and that's the $1 million question, right? It's like, how much PFAS is actually in my body? And I will say, also putting pressure on retailers, putting pressure on the fast food industry to remove some of this stuff. And then also, Dr. Goodrich, you mentioned that there are regrettable substitutions, that they're like, oh, well, this isn't PFAS, but it's just as toxic. And I think it's kind of that greenwashing era of, oh, well, you know, this product is healthy, but it's really not. US EPA has issued a carcinogenic RSL for PFOA only at this point. Are there any studies that you can recommend that provide background on the development of carcinogenic risks of PFAS chemicals?
Yeah, so really quick, I want to jump back because Tina had a good question or comment here that there is one company, Eurofins, that does PFAS testing. I'm not sure though if they if those are commercially available. But anyhow, yeah, that's something that people can look into. For the US EPA, carcinogenic. So the California EPA had a report that came out last year on the carcinogenicity of PFOS as well. But a lot of that is kind of just in the works right now. I can't really think of very many others, or I'm not aware of any others. That doesn't mean they're not out there.
Right, and I think like an also a good point during the presentation is that more of these research comes out, the more people pay attention to it. And I actually found Dr. Goodrich's and his team's study on PFAScentral.org, which I'll drop the link here shortly, which will give you a plethora of information on how to reduce exposure, some of the leading research done by amazing people across the country to stop PFAS. PFAS no mas is the motto that we've been going with over here. One more question from Patty. What cleanup methods exist for PFAS in the environment?
Yeah, this is something that I am not an expert in. And I only have what I've heard from environmental engineers, but there's not great options right now, other than the kind of treatments, the water treatments. I'm not really aware of anything actually at the moment. So that's not that's not a great way to end it, but unfortunately that's what I think is the answer.
And I think that kind of just speaks to the importance of, just more research needs to be done. I feel like 10 years ago, people didn't even know what PFAS was, the general public speaking. But I feel like there has just been a lot more coverage in mainstream media on this matter, which there should be. I think that is all the other questions. I think that's it for now. I do want to say again that this has been a production of CHE Alaska, Collaborative Health in the Environment. It's a program of Alaska Community Action on Toxics, and we're also part of CHE's broader network of over 5,000 individuals across the globe providing environmental health news and information. One more question, I guess, Dr. Goodrich, for you. What's next? What are you gonna research next?
Yeah, I have two interesting areas. Well, so three more things that I'm kind of looking at is, I think the carcinogenicity is an important one. So I'm getting more into trying to figure out whether these compounds cause cancer. One area that people haven't looked at as much is kidney health as well. So the kidney is a really interesting one because impaired, so PFAS can actually harm the kidney, but they also, the kidney is responsible for removing PFAS. So that means that there's kind of this vicious feedback loop where PFAS can maybe cause harm to the kidney. That means that maybe you don't eliminate PFAS as fast, and it kind of just gets worse and worse. And so trying to kind of figure out what's going on there is really important, because in the future, maybe if we can improve kidney health in some people, that means that PFAS levels will decrease faster. And then I'm also working on some other, I kind of hinted at this a couple of times, but I'm working on some studies that could potentially, be lifestyle interventions to decrease the harms of these PFAS. So it's a little ways out, but hopefully we have some good news in the future on that.
Right on. And Elizabeth also just asked for the link to you and your team's work. So I just dropped that in the chat as well. And I will also mention that all the links that we talked about here will be sent to you in a personalized email follow-up because we're going to put this on demand as well. So you can run it back anytime you want. And Dr. Goodrich, again, thank you so much for taking time out of your day to talk about the forever chemicals. And we hope that everybody can come back again next month.
This was great. Thank you for having me.
Yeah, of course. And we'll leave it there for now. Take care, everybody, and have a great day.